Hello, everybody. My name is Abdul. I'm a physical therapist, and this is my first uh, uh, YouTube I'm going to put in. But today I'm going to talk about the triangle of healthcare, which is, they say the cost, the quality, and access. And they call it the iron triangle. I think the name uh, says a lot. They call it iron because they want to give us the impression like it's hard to adjust, it's hard to change, and that's why it's made of iron. Iron is not a flexible material. Iron is very solid, rigid, and that's why they want to give us the impression like you can't change the cost, you can't make it affordable, you can't make healthcare affordable, you can't if you're gonna make it, if you're gonna cut the cost, that means you're gonna cut on the quality and you're gonna cut on access. But I don't think that's true. Uh, we could call it noodle triangle, or we could make it we could say it as a spaghetti triangle. We could make it anything. Uh, so the name, I think it's a wrong name, and that's why I think we should rethink about this triangle, naming it differently, because I think we could change the triangle, and we could change one angle, or without changing the other ones, so we could still cut down the cost and maintain a good quality and good access. Um, I want to just give you some stats here to think about it. I don't want to, it's my opinion. It's nobody's other. I mean, I'm not speaking on anybody's behalf. I'm speaking in my own. So please just think about what I'm going to say and then investigate it, uh, look into it, read about it. But just I'm going to give you one example. Like the cost is a lot, and we could, if we could cut the cost, we still could have a good quality of care and good access, because they say when a physician become a part owner of an MRI machine or a scan machine, CT scan, I mean, the number of CT scans done for Medicare patients increased by 65%. And MRI scans done for Medicare patients increases by 94%. If that's not wrong, I don't know what's wrong. Uh, why do we have to do CT scans and MRIs for Medicare patients just because they have benefits? If they don't have benefits, I don't think the doctor will order that test or that exam, or to make another scan for somebody that doesn't need it. But because the doctor or the physician knows that this patient has benefits, he goes and order that, he or she, I mean, he goes and order that test, just because the patient has the benefits, and the doctor will benefit from that one too. So I don't think, you know, I want to say 80% of the time, the doctor decisions to make this test or that test is not financially neutral. It's usually he is benefiting from that test, or benefiting from that the scan. So please think about it. It's not. I think it's a big deal. I think we should educate ourselves and then go from there. But these tests, these scans, these a lot of things that's done. It's not for the benefit of the patient. In fact, they say sometimes it, doing a CT scan or an X-ray or something that's not needed, it increases the patient's risk for radiation-related cancers. Just think about it. We're not benefiting the patients. In fact, we're harming the patients, and we are just benefiting the physicians, or who's ordering that tests, I believe. Okay, thank you very much.